All right, so we have our HR director, and this is kind of just a refresher and overview. Ms. Rita Howell.
Good afternoon again, Council. Since we've had open enrollment, since we've gone through a complete plan design change with our health care, and we've had open enrollment, we finished that up the end of October, and the changes that have been approved will become effective on January 1. Because the changes were significant, we wanted to at least give a quick review of the open enrollment, what happened and the outcomes, and then so for your sake as well as for employees, we'll be communicating with them up until January 1 so that they know what's going on. But I wanted to provide a quick overview here for Council as it relates to health care and open enrollment. So we'll have 2 medical plans as opposed to the current 3 plans that we have. There will be a silver plan and a gold plan. The Health and Wellness Center will be open to all employees on either plan. The prescription drug plan, we simply changed vendors. We're currently using Express Scripts. Come January 1, we'll be using Pharmaville. That will be our new pharmacy benefits manager. However, there are no changes to the prescription drug plan. The copays are exactly the same as they are in 2016. They'll be the same in 2017. Our dental insurance provided by Blue Cross Blue Shield, there is no change there. No copays. The vision insurance provided by Blue Cross Blue Shield, there are no changes there. The ID cards are something that the employees always try to make sure they have in hand, and we try to make sure that they have them in a timely manner. As long as they have them by January 1, everybody will be good to go. So we are in a very good spot now in terms of the implementation of the changes that will be effective January 1. So all employees will receive a new ID card. They will receive a new ID card from Blue Cross Blue Shield. It will come in the mail to their home address. They, on that ID card, they'll only need one. It'll have their medical information. It'll have their dental information if they sign up for dental. It'll have their vision information if they sign up for dental. This year will also include their prescription drug information. It will be on the back of the card. Right now with Express Scripts, you have 2 cards. You have your Blue Cross Blue Shield ID card, and then you have an Express Scripts ID card. Come January 1, you'll just have 1 card. It'll include all your medical, dental, vision, and on the back of the card, it'll have your prescription drug information. The ID number for your medical will be the same ID number you'll use for your prescription drug plan. For employees that we'll send more information out, but for employees as it relates to our prescription, because we are changing vendors. You see the new email address there to pharmaville.com and the new 800 number to call about prescription drug questions that you might have. So the cards will be mailed out the end of this week, so employees should receive those the week of December 26th. Also, employees that sign up for the flexible spending account, they will now receive a debit card. This is new, something that we haven't done in the past, but it just makes it more efficient for those folks who participate with the flexible spending account. There are 140 employees participating, and those cards they should receive those the week of December 19th, so next week. The new benefit that's been added, the telemedicine benefit, we had 118 employees sign up for that benefit, and they'll receive their information packets in the mail as well the week of December 19th. All of this will be coming to the employee's home address, so when you get information in the mail, be careful about not throwing it away. Take a look at it because your ID card might be in that mail. I wanted to just talk a little bit about the participation so far as enrollment was concerned. In 2016, there are 2,009 employees that are enrolled in medical, okay? For those employees that participated in open enrollment, there were 1,334 of that 2,009 employees. About 66% of employees participated in open enrollment. Of the retirees, the pre-65 retirees, there are 234 that are enrolled in medical in 2016. So about 95 or 41% of those actually participated in open enrollment. For those employees who did not participate in open enrollment for 2017, if they did not participate, they did not select a plan, they will be defaulted to the silver plan, effective January 1, 2017. And this is important because typically, open enrollment, sometimes participation can be low. Although we want every employee to participate in open enrollment, reality says that a lot of employees will say, well, I don't want to change anything. I'm just going to keep what I have. And that has worked in years past. However, because we had plan design changes, employees needed to select one or the other. You couldn't keep the HMO because the HMO plan went away. You couldn't keep the Health and Wellness Center plan because the Health and Wellness Center plan went away. You couldn't keep the POS plan the way it is designed currently because it went away. So we needed employees to select either the silver plan or the gold plan. And I will say from an open enrollment standpoint, participation was good. It was not 100%. Ideally, we would like to have had 100%. So for those employees that did not make an election so that they can have health insurance come January 1, they are defaulted to the silver plan.
Question.
Yes.
Councilor Barnes.
I remember at the last meeting, you did say how exhausted you were in notifying. So now, is that still going on at the departmental level where the department head will tweak the employee and let them know, you haven't selected a plan? Is that in operation?
No, because open enrollment is passed. That's when the
I see
employee
what
gets
you're
a chance
saying.
to do it. Yes.
So now it's just too late for them?
Yes, essentially. That's why it's a period of time.
But you did at the meeting that we spoke to. What I'm saying is that at the meeting that I referenced, you said that you used every means
Absolutely.
possible
Absolutely.
to include the department heads contacting employees, and they didn't do it. So they've had what I'm trying to stress is that they did have an opportunity to select.
Absolutely, and I've got a
Okay.
couple of slides on that, Councilor Barnes, because
Okay.
communication is a challenge for us, because our employees are spread out so throughout Muskogee County, no matter how many emails, how many meetings, it's still a challenge to reach every employee. Even with something this critical, it's still very challenging for us, so it's just something that we have to work on.
I know we spoke about that at the meeting and just can't identify exactly what the problem is.
Absolutely, absolutely, we're working on it, absolutely.
Councilor Baker.
Thank you. You may be going to address this. It sort of follows up on something that Pop's mentioned about communication. I do know that some of the assessments to get the $500 credit assessment sites were canceled. What was the follow-up to that?
I am going to talk about that.
Okay, I'll wait. Thank you.
And then I'll.
That's fine.
Okay, very good, thank you.
All right, we've got Councilor Huff.
Quick question on the flexible spending account. Did I speak? Good afternoon. How you doing?
Good, thank you.
It said that debit cards will be mailed.
Yes,
Will those debit cards have the new chip on them?
good question. I don't know if they're going to have a chip or not.
My thought process is it's been some information moving around about protection of that card. So as they carried it around, you should have a small little shield to cover it because people can steal your information and take that money off your account. All of the new cards with chips.
I'll verify it, and in the communication that I'll be sending out to employees, I will include that information as to whether it will have a chip in it or not.
Have them check into being safe so that they don't go in and someone has their money and gone.
Absolutely.
Okay,
Good
thanks.
point. Thank you. In terms of the open enrollment by plan, just wanted to share this with you. With regard to the silver plan and the gold plan, a total of 1,715 employees are in the silver plan, 296 employees are in the gold plan, and for those pre-65 retirees, 205 are in the silver plan and 29 are in the gold plan. As you can also see, the majority of employees are on employee only. That's for the active employees as well as the retirees. No matter which plan you're looking at, the majority of employees are employee only, and the next largest group for active employees are the employee and children tier. With regard to the 2% pay increase and the insurance premium, this was a referral from, I believe, Mayor Pro Tem Pugh. The question was whether the 2% pay increase that will be effective January 1, whether it will fully cover those employees that selected the silver plan. And this slide shows that 119 employees, the 2% will not completely cover the cost of the premium. Those employees, just for information, those employees were all on the Health and Wellness Center plan, and those employees have selected the silver plan. 80 of those employees are in the general government. 39 are public safety employees, and by tier, 80 of those employees have family coverage. 20 of those employees have employee and spouse coverage. 19 of those employees have employee and children coverage. Annually, for those employees, that cost is $19,628. Mayor Pro Tem Pugh, does that respond to your question? Say that again?
Per,
That's the total for those 119
all
employees
19?
annually.
All 119 together? Okay.
Yes, that will be the annual cost that's not covered by the 2% pay increase.
What if you applied the $500 credit to that? Would those numbers change?
If you applied the $500 credit to that,
That's it.
well, that's
I mean,
$500.
it's not included in that number is what my question was.
That's correct. It
Okay.
is not.
Thank you.
That's correct. So all of those employees would have an opportunity to participate and receive that credit.
Right, thank you.
That's correct. Good question. Good point. And I hope this gets to your points also, Councilor Baker. I wanted to talk about the wellness initiative that we were able to put in place that you approved. 450 employees have participated in the wellness initiative. And just for your recollection, this allows employees to receive a $500 credit on their deductible that helps to offset their deductible. By participating in the health risk assessment, they get a $100 credit. By participating in the biometric screening, they get a $200 credit. If they are not deemed at risk, they automatically get the additional $200, which gets them to $500. If they are deemed at risk, they participate in coaching, and then they still get the $200 credit. I just wanted to share this little pamphlet that each employee that participated in the personal health assessment will receive a pamphlet like this mailed to their home address, and it's really extremely beneficial. It talks about it gives you just great detail about your health, from your heart to your kidney to your cholesterol to your BMI, you name it. It goes into great detail. So every employee, at least these 450 that participated, will receive this document. Chances are they've already received it. This is mine. I was really pleased to get it and get it at home. I got a lot of green. You either get, what do you get? You get green, gold, or red. You get green, gold, or red. Green is good. Red is not, gold is not so good. Red, you're at risk. So while mine is not quite as good as the city manager's, who was bragging about his the other day.
He made it a point to brag.
He made it a point. But it is so very, very good. It's helpful. I mean, it's a little document you can take and use it as your starting point for where you want to go with your health. So So all of those employees that will get that, ideally, as it relates to the wellness incentive, and we got a lot of pushback on it, but ideally, this is the thing that we want to do annually. We want to have a health risk assessment, a paper document done every year. We want to have those biometric screening done every year. And, if we're at risk, we want to have the health coach interact with us so that we can improve those areas of risk. And I'll just also take time to say this. When we were doing all these meetings with the employees said, well, why do you keep, every time you come, you're saying, you're asking for more money, health insurance is going up. So, why do you keep doing this? Well, unless and until we do something about this, unless we do something about taking responsibility for our own health, we're going to still talk about the money associated with health insurance. But when we start taking that responsibility for our own health and doing something about it, that helps control the cost. So I would love to not talk about money, but we got to talk about how we take responsibility for our health.
Counselor Barnes.
You want to know something? I don't know why any employee would not take advantage of this here. I mean, this is excellent, and I'm glad I didn't know at the meeting. I got one of the green books, but I didn't know that every employee received a copy of that. That should be incentive enough for them on a personal level. If they want to be on this earth plane a little while longer, and especially for their loved ones, they need to take advantage of this here. I stress this continually, that you need to have it. And I know the city manager was glad that all his running every morning paid off for him.
Absolutely.
But it's really for your own personal health. And yes, in the long run, in the overall scheme of things, if each employee adheres to something like this here, it will drive the health costs down for the employees.
Absolutely.
But this is a gift. I mean, this is great. Wellness initiative.
So in addition to receiving the $500 credit on your deductible, we further incentivized every employee that participated by giving them a $50 gift card. So that's something to have in time. We also gave them, or they will receive a gift card from either Chick-fil-A or Subway. So we're continuing trying to incentivize employees. Now, Councilor Baker, you asked about some of the events being canceled. Some of the events, we rerouted them because the folks that were doing the screening were we were paying them. They were coming out of Tulsa. We didn't have enough employees signed up for an event that we had 2 or 3 people. There was a whole staff of folks that were assigned to come and do the screening for them. So yes, we ended up rescheduling some of those events. We redirected those to the Health and Wellness Center for those folks who could have the PHA done, have the screening done. So we've done a couple of those last week. We've got 2, I believe, scheduled this week. So we're trying to get every employee in. They do get those employees still participating. They're going to get this. They get the $50 gift card. They get the Subway or Chick-fil-A, whichever. They still get the same incentives. They still get the credit on their deductible. At the end of this year, though, that will go away because we need to be able to do the aggregate numbers from the information that we're collecting. But we did reroute some of them because the participation was so low.
Is there a time, would you go with a time frame to still, for those that may not have gotten a message, is there a time frame to still get in?
Yes.
Could you explain that?
I believe it is December 13th and December 15th from 8 till 5, any day. I'll
Does
send
the
out.
company schedule those where you call the number on the brochure, or do you schedule that through HR?
They can call the number, the 1-800 number that's on the brochure, the information that we've sent out. They can call the Health and Wellness Center and make an appointment. Yes.
Thank you.
Thank you. So as I mentioned earlier, as it related to open enrollment, just the challenge of communication. Ideally, we'd like to have 100% participation in open enrollment, but we know from past experience that typically doesn't happen. And even though we really needed everybody to make a selection this year, to get 66% participation, that was probably pretty good for us. Even after having 25 meetings and touching every department, that's still, to try to get information out to employees. We had an online benefit resource center that provided information for employees, education information. We had customized videos. Those are still available on our website. Employees had an opportunity to have a one-on-one with a council member. If they didn't understand what the benefits were, they had a chance to do that, talk one-on-one. They could go in and schedule a meeting. They could call the 1-800 number and have a conversation that way. Or they could do self-service. If they felt like they could do it themselves, it was pretty simple enough, straightforward. Get your login information, go ahead and complete your benefits information there. But even with all that, we still had some challenges with communication. So that's something that I just share with you all, that it's a challenge for us trying to reach our employees, even though the information is extremely important, even though they need to participate. It's just very challenging. And I can appreciate an employee that works out in the field. They rarely come in the office. They don't have email access, and that's one of our primary ways of communicating is email. But for somebody that doesn't have email, it can be a challenge. They're depending on their supervisor to give them that information. And sometimes we get a gap there, so we're continuing to work on that. Any questions?